Okay, good afternoon. Myself and Dr. Reitav today will be discussing the importance of self-compassion. So just a couple ground rules. These sessions are for education only, and please ask your healthcare provider for specific advice about your situation. So by the end of today's session, you will be able to identify the following: what self-compassion is, the 3 elements of self-compassion, myths of self-compassion, and some tips for practice. So to begin with, what is self-compassion? Self-compassion is when you can recognize and acknowledge that you are suffering, that you can treat yourself the way you would treat someone who is experiencing pain. You can ask yourself, what can I do to comfort myself right now? Self-compassion is also to honor and accept your humaneness. So this means recognizing you're not perfect and that things will not always go the way you would like. So there's 3 components to self-compassion. The first being self-kindness. So when you're self-compassionate, you're warm and understanding with yourself versus being self-critical. We cannot always be and or get exactly what we want. When we deny and or fight this reality, suffering increases in the form of stress, self-criticism, and frustration. So when we accept we are suffering and are gentle with ourselves, it's easier for us to move through it. And this is, it's sort of a foreign concept, I think, to many people. And so bear with us, but hopefully will help you to understand why self-compassion is so important.
So the second element of self-compassion is the idea that much of the suffering that we are experiencing or do experience as we continue through life is not personal, it's not just us, and that there is an element of common humanity, that many of these challenges that we're facing are not just us alone. And I think that's very, very important in terms of beginning to get perspective. I think for all of us, as we are experiencing something that is difficult, we're generally going to be feeling pretty down or pretty overwhelmed. And it's when you allow yourself to kind of step back a bit and notice that you are not alone and you're not the only person who is suffering or making mistakes or struggling in one way or another. So it's when you're much more taking it personally that it actually increases your frustration, increases your sense of being overwhelmed. But once you're able to kind of pull back a little bit from that and to understand that being human means that one is mortal, that we're all vulnerable, we're all imperfect. And of course, being in this COVID-19 worldwide pandemic is really underlining that, in fact, it is the whole world, all of us at the same time, struggling with being able to manage in all the sacrifices we have to make for it.
The third element of self-compassion is mindfulness. So meaning taking a balanced approach to our negative emotions. So this means not suppressing or over-exaggerating our emotions. So it's really important that we validate how we're feeling and we don't ignore how we're feeling, but at the same time not getting swallowed up by it. And unless we validate how we're feeling, it's really hard for us to move forward.
So there's a number of questions that do come up when we start talking about self-compassion, because there are many other related phrases that we use in day-to-day life. We talk about self-esteem, we talk about self-criticism, self-pity, self-indulgence. So, and all of these things are different from self-compassion, I would argue. And we're going to sort of walk through some of the common misconceptions or myths that people have about what self-compassion is. One of the main ones is the idea that if you are being self-compassionate and you are focusing on whatever the suffering is that you are personally going through, that you're just taking pity on yourself. You're just wallowing in this state of being too focused on the hardship. Well, in fact, research that has been done on what self-compassion is and what the elements of it are, which are the three elements that we just reviewed with you. You know, that sense of being part of the human condition, being mindful of the actual experience and not taking it so personally. That actually helps you get out of that self-pity. So one of the hallmarks of self-pity is that we get stuck, right? And we get into a state of mind where, you know, the same phrase or thought goes over and over in our minds. And it's hard to get any distance, to step back from it. And in research done with students in universities, looking at the difference between self-pity and self-compassion, that those who scored high on self-compassion tended not to wallow in that state of vulnerability. They would recognize it, but they would also then begin to ask themselves, so what can I do? What steps can I take? And so forth. So it's a recognition of a problem, but not being so critical or so hard on oneself. So very different from self-pity. Another idea, and this is probably true of many men, the idea that, well, to be self-compassionate means you're being weak, you're being a sissy. And again, it's very possible to be compassionate with situations that are overwhelming, that are difficult, and not being weak, but instead using it as an opportunity to look honestly at something that needs to be looked at, trying to understand it, trying to make sense of it, and ultimately to take some steps to begin to change the situation itself. So it's instead of weakness, it seems to be a way, a path forward and out of some of those difficult situations.
Another myth is that self-compassion may make us complacent. And people think that when we're self-compassionate, we're not going to be as motivated to do things. But again, by recognizing that we're finding something hard and by validating that and being kind to ourselves, the research shows that those who are self-compassionate tend to reach their goals more so than those who are very self-critical of themselves when they use that as a form of motivation. Another myth is self-compassion means self-indulgence. And I guess also that it means selfishness. But when we don't meet our own needs, it's really difficult to actually meet the needs of other people. And so when you are self-compassionate with yourself and you take the time to take care of yourself and do what you need to do for yourself, you're much more likely, you'll have more space within you to take care of other people and to do it well. The last one is that self-compassion is self-esteem. So self-compassion is different from self-esteem. Self-esteem is really looking outward in terms of the evaluation that others have of us. Whereas self-compassion is more about, not sure if I can explain this one as well.
Yeah, so I think our self-esteem is about things we do, our competencies about this or that, whereas self-compassion is just how we feel about ourselves emotionally. Do we feel we're good enough? Do we feel that we're helpful, kind, generous? Yeah. So what we're going to do next, because you're not here with us and we can't directly interact with you, but we want to include you in thinking about whether you would say that you feel that you are needing some of these self-compassion exercises or not. So we're going to do a quiz with you, and if you have paper and pencil, I'm going to ask you a series of questions, and you can just sit and listen to the question and then decide, is this true of me or not? So, and if it's true, then put a check mark down. If it's not true, then you can just wait for the next question and decide, is that true of me or not? And it doesn't have to be true of you 100% of the time, but if it's true of you, reasonably often, then it probably applies to some extent. So the first question is, I find it hard to be kind to myself. True or false? If you think it's true of you a certain amount of time, put a check mark down. Next, if something goes wrong, I automatically blame myself. Is that true for you? I don't deserve to do nice things for myself. Next, I am very critical of myself when things aren't going well. When I'm having a hard time, I wouldn't even think to look after myself like I would a friend. I focus a lot on my faults and flaws and can't let them go. If I make a mistake, I give myself a really hard time. When I'm struggling, I don't treat myself with much care. I can't accept mistakes I've made or things I haven't done well. I think over and over about things I don't like about myself. I'm not very gentle with myself when I'm suffering emotionally. If I make a mistake, I feel like I should be punished. I feel like I'm the only one who struggles or fails at things. So those are the questions. And if you have no check marks, then you're doing really, really well with self-compassion already. But if you had some check marks, then we're going to walk you through an exercise to begin to think about how you could do things differently.
So hopefully you have a piece of paper and a pen. So this exercise is, how would you treat a friend? So we want you to think about times when a close friend feels really badly about him or herself, or is really struggling in some way. How would you respond to your friend in this situation? So especially when you're at your best. So think of a time when you're particularly at your best in giving a friend some support. Write down what you typically, or what you did what you said, and note the tone in which you were talking to your friend.
Yeah, so take a minute to do that.
And remember, this was when you were particularly at your best in supporting someone. And now I'm hoping that you'll think about a time when you were feeling really badly about yourself or were just really struggling. And how did you respond to yourself in this situation? So again, I want you to write down what you said to yourself and also note the tone in which you were talking to yourself. And the hope from this exercise is if you respond to your friend and yourself the same way, that's probably a good thing. But often what we find is that the way that people respond to their friends versus themselves is very different. So we often are much more supportive of our friends when they're having a hard time than we are of ourselves. So notice if there's a difference and ask yourself why. What factors or fears come into play that lead you to treat yourself differently than the way that you treat people close to you? And I'm hoping that you could write down how you think things might change if you responded to yourself in the same way that you typically respond to a close friend when you're suffering. And this is something that's not easy to do. It takes practice, and usually you don't recognize how powerful it can be until you actually try it in a situation where you are suffering. That, to me, would be a time to really try this out and to think about what you would do or what you would say to a friend, and then to do that for yourself. And I know from experience that when I've done that, when I've been suffering or finding a situation very challenging, that when I take the advice that I would give to a good friend, it makes a huge difference in my own mental well-being.
So hopefully, as you walk through this exercise, you're beginning to see some differences between the ways in which you are considerate and caring and kind with a friend who is struggling, and maybe some of the ways that pop up automatically in terms of how you treat yourself. So it's in seeing the difference that there is an opportunity for change. And the important point here is that you begin to see for yourself what is different. Now, just seeing the difference itself does not make for a change. So the next thing would be to look at the ways in which you could begin to treat yourself in exactly those ways as you treat a good friend. And when we've used this exercise here with some of our cardiac patients, one of the important points that the patients understand is the importance of practice. That we're really changing our attitude, we're changing how we automatically think about ourselves, and that it's only by practicing these insights and repeating them over and over that we begin to actually do them more instinctively, that the pattern begins to shift. You can think of these as brain patterns that kind of get stuck in a certain rut. And once you've developed those patterns, they're going to continue in that way unless you give your brain a good reason to switch out of that pattern. So that's one of the things that we would urge you to do. And how would you go about making some changes? Well,
So this is actually a workbook on the mindful self. Well, it's the mindful self-compassion workbook. And Kristen Neff and Christopher Germer, both are gurus in self-compassion. And this book takes you through many different exercises to help you become more self-compassionate. And one of the things that they really emphasize is even if you're not self-compassionate right now, it is something that you can change, and you can become more self-compassionate. So both Kristen Neff and Chris Germer have websites that if you Google them, you'll find some more information. On their websites, they both have some meditations, one which we will do today. They have some shorter ones and some longer ones on self-compassion. And they also have some exercises on their websites that you can try out as well. Kristen also has a longer version of the self-compassion test, which if you sign up on our website and take the test, someone will send you the results to show you how self-compassionate you are.
Mm-hmm. Yeah, I did that test myself yesterday, and it's pretty easy. You just click on the answers, and at the bottom you hit, mark your test, and it gives you your score on 6 different aspects of self-compassion. So it's pretty easy to do and useful to see how you're doing. There are many resources that we can point you to that are free and that you can explore, and we would encourage you to do that. And those links and so forth will be available in the answers to the questions that are asked. Okay, so that.
Yeah, but if you go to Kristen Neff's website, the self-compassion meditation that we were hoping to share with you is on there, and it's about 5 minutes in length. So please, if you're interested, look that up. She also has a TED Talk on her website that talks about the difference between self-esteem and self-compassion, which is very well done, and she takes you through the steps of what self-compassion really looks like. So again, something to look at if you're really interested in learning more about self-compassion.
Mm-hmm. Yeah. So, as a summary, these are the things that we wanted to bring to your attention. Most important, once you have the idea that self-compassion is a skill, it is something you can get better at, it is something you can practice, that we're interested in hearing what your thoughts or maybe some of the concerns you might have about how you might go about doing this. And we'll spend the rest of our time today answering questions and trying to help each of you move forward in your own abilities to use self-compassion in your day-to-day life. So we're at the question and answer part of the format, and if you go to the pop-up screen, you'll see one of the icons that shows up says Q&A, and if you click on that, you can type in answer questions and send them on to us, and then what we'll do is try and answer these questions for you so that we can get you started on using self-compassion in your day-to-day lives. The first question that has come in, I'll read. We will soon be coming up to 3 months of isolation. We will be weak physically due to lack of activity and diet. Hard to get back to normal life and to meet others. How can we increase our self-esteem to behave properly? So I think the person probably meant self-compassion. Self-esteem is what you feel about what you're doing. Let's say how well you do a job. Self-compassion is about how you feel about yourself. And of course, as this questioner highlights, is, we can't be feeling terribly great about ourselves if we've been in isolation by ourselves, away from our friends, our family, people who we care about a lot. And if it's altered our ability to eat and be active and exercise the way we normally would, that can be a real hurdle to overcome. So Claire, what do you think? Is there ideas?
Well, I think this is really a time where we couldn't be more self-compassionate towards ourselves. Coming out of 3 months of isolation is going to be challenging in different ways for different people. And so I think it's really important to recognize not to be hard on yourself and to be gentle with yourself during this period of time. So really thinking about what you would be telling somebody else who you care a lot about, who's worrying about the fact that they haven't been as active as they wanted to be, that they haven't maybe been eating as well as they wanted to, and that if you can be kind and gentle with yourself, and also just validate how you're feeling, that this will help you to move forward and to start to become more physically fit and to improve your diet and your overall well-being.
Yeah, I think, I would add that even though we are in physical isolation, as long as we obey the rules of distancing from others, we certainly could go out and exercise, to get a walk in the morning. There's very few people anywhere, at least not in the neighborhoods that I live in. So you can get out, you can exercise, you should be able to keep your energy level up. And I would say, remembering about the common humanity idea, that it's not just you who's coming out of 3 months of isolation. The person who you're greeting also will have just gone through 3 months of isolation. So both of you have something to share, and it might one day be something like war stories that we trade about, how bad it was, or I had it worse than you. I'm not saying we're there yet, because we're still in the middle of it. But for sure, this is something that's unique in our time and is putting a strain on all of us to manage in as best a way as we can. So that common humanity idea is an important piece of it as well. Next question. The COVID-19 workbook is available in English and French on the Cardiac College website. Visit the homepage and click on the COVID-19 resources button and click this link, and so there is access to it. So it's something that you can download, and it guides you through a number of these exercises. Hopefully it'll get you thinking about ways of managing and can be used to answer this question we just read, to prepare you for when isolation is over. And by the looks of it, it's going to be staged or phased in. So it's likely that you'll be able to, let's say, meet with a family member or something like that in small bubbles, I think they're talking about, so that you kind of gradually increase your ability to reconnect with others in a very slight way. Okay. Next question. I've been looking for last week's, you've been looking for last week's webinar online. Does not seem to be available. Yes, apparently we had a technical glitch or a malfunction and the recording did not take, so sadly it's not available, but I do believe the slides and the Q&A and the other information that we conveyed will be there, but not as a video, so you will have access to that. Okay. Is it possible to overfocus on self-compassion to the point of having trouble reconnecting and being compassionate to others? There's a good question.
That's a good question.
Is there too much of a good thing? What do you think, Claire? I would say self-compassion means connecting with your own struggle. And I think one of the things that comes from really appreciating your own struggle is it actually opens the door to being more compassionate with others, not less. That we don't kind of get lost in our own suffering. We actually understand how it is such a challenge for us. And it allows us to be more understanding of others, or to ask them how they're doing, and to genuinely be more interested in them. So I think often it works paradoxically to bring you closer to other people.
Yeah, and I think if you are feeling like you're having trouble right now reconnecting and being compassionate to others, it may be that you're not being compassionate enough to yourself right now, and that you need to be if validating that you're suffering right now, or that you're finding things very challenging. And so you're needing to sort of fill your soul back up before you're able to reconnect and be compassionate to others.
Mm-hmm. Yeah, it's a process, I think, right? It's not just a single exercise or act, but it's really reflecting in a deeper way on your own experience. The next question, how should I deal with the guilt and worry about not being at work? I know I need the time to deal with myself, but work always is on my mind. And yeah, I think that's something that probably many of us experience, partly because we value the work we do, and we know what it is that we're able to provide others. And then if you're not allowed to go in and to do that, it is difficult for sure. I guess the only suggestion that I would make is that you might consider connecting with, other fellow colleagues at work, if you have, phone numbers or other ways that you can connect and stay in touch with them. And it may help a little bit in just kind of talking about how you're each struggling with, this new situation. But also it begins to allow you to think about when finally you are able to go back, what are the priorities, what might you do to kind of productively think about what would be helpful to you to do once you're able to. So I know there is now talk about phases of returning back to normal, and there's 2 or 3 or 4 phases. And at some point, you will be called on to go back and to resume work. And so having some kind of a productive plan on how to do that is maybe a good way of using your time.
Yeah, the last question is, how can we handle other people coming too close to me when out for a walk or shopping? What can we say to them, especially since they do not appear to speak English?
That's a tough question. And there's for sure a lot of variability in how closely people are following guidelines. Um, One of the important things that we need to understand about our emotions is if we have embraced a rule, if something has such importance for us, like keeping to physical distancing so that we don't get ourselves sick or others sick, we feel strongly about that rule. And sadly, in society, there's always people who don't share the same interest in the rules or feel that somehow they may be immune to those rules. I'm thinking particularly of teenagers here because, always teenagers have been the rebellious bunch in society. And heck, if I go back to when I was a teenager, we had Woodstock and, all of these music festivals that I'm sure our parents were cringing about. Why were we doing all of this nonsense? So there will be people, especially younger people, who don't see it as their issue, and they won't behave in ways that are respectful. So understanding that anger is very common, that's the way in which we usually respond when somebody is not observing a rule that we have taken to heart. So the anger is, I think, natural. Um, I doubt that you'd be able to say or do something that might change the minds of people who are, especially teenagers who are gathered together. But you might try. You might think about what you could say that might make a difference. But it's a tough question for sure.
Yeah, and I think, if you say it in a kind way, sometimes people, they go back to their old habits where they're just thinking about something else or they're distracted, and so they're not even recognizing how close they are to you.
Yeah. I would say that, certainly across the last 2 to 3 months, that I've really noticed much, much more of an effort by everyone to respect physical distancing. Even when you're walking on a sidewalk, people go to the other side of the street or move into the roadway. So I think if you can focus on all of the people who are doing a good job and just take heart in that there's many, many people who understand the message and the seriousness and are doing their best. And there will always be those who don't quite understand. So that's just, I think, human nature, sadly. So with that, I think we've finished the questions that were submitted. I do want to draw people's attention to tomorrow's session, which promises to be really exciting. Dr. O is going to talk about coronavirus mythbusters, part 2. So this is going to be, I guess, a sequel. So if you already saw part 1, this will be the follow-up. If you didn't, it's probably taped. You can watch that and then catch Dr. O with follow-up. And if you had questions that weren't answered, you can ask those. And tomorrow morning at 10 a.m., we're going to have Maria Recupero, who's a registered dietitian here at University Health Network. A wonderful, wonderful person, a good speaker. She's going to talk about a very important idea of being healthy at every size, which is a way of redefining priorities to health and well-being and to our diet. So that's our series on women with heart. And we encourage all of you to take part in and participate. and listen in on that. And with that,
Next Monday is a holiday.
yes,
Just to remind people that there won't be a session next week, but that will be back the following Monday, the 25th of May.
yes. So between now and then, enjoy your practice of self-compassion, and we'll see you in 2 weeks' time.